Channel 4, the local station. This is Look Local.
But we begin with CNS Healthcare, and Susan Angel joins us now to talk about the different trials that they have going on down at CNS Healthcare. Thanks for coming in.
Thanks for having me.
Listen, we've got a lot of different trials to talk about today, it sounds like.
We do, and what's interesting is the first thing I got to talk about is we have an option for people suffering from the flu.
Really?
Okay, right now, according to the CDC, the flu is widespread in our area, and it's predominantly influenza type A. What we're doing at CNS Healthcare, we'll provide you a free screening to see if you have influenza type A, and if you have it, we'll give you the treatment.
Really?
So no insurance needed. You don't have to pay anything out of pocket, but if you test positive for the flu, we will treat you for that at no cost.
That's very good. So, and the nice thing about this is there's no cost for, like you're going to say, for if you're suffering from the flu and you come back positive with the flu, then you're going to get the treatment free of charge, which can be very expensive.
It can be.
It can be, because my daughter had it last year. It was very expensive to treat that.
Yeah.
And just with all the other trials that you guys have as well, you don't have to have health insurance, which really can help significantly. You guys have asthma, diabetes, fibromyalgia, the flu treatment, as Susan just said, knee pain, and migraine headaches.
Yep.
So you guys have a lot of different things going on right now.
And most oftentimes, you know, people think of CNS Healthcare. They're very familiar with us doing our clinical trials for depression or attention deficit disorder. But we've really expanded the options for medical care. And as shown on the screen, there's a list of studies that we're currently enrolling in. And there's a lot of great benefit because you have access to new treatments that you wouldn't normally have in your physician office. You've got state-of-the-art care, routine follow-up. You know, we're assessing your lab work, assessing through EKGs, vital sign measurements. You know, you've got one-on-one time with staff, and it's a real good experience.
And you're covered. You cover everything, like you said. You do a full workup on the patient, so that you know that everybody, you know their health conditions going in before any of the trials start, which is good to have.
But for some of the chronic conditions like listed up there, like fibromyalgia or for migraine sufferers, those things are conditions that can be kind of chronic, and they can definitely interrupt your day-to-day life. So finding a treatment that's effective, that doesn't have side effects, is a real great thing for those folks suffering from those diagnoses. So, you know, if you have that, please come on down. In terms of our knee pain clinical trial, you know, oftentimes you think of people take anti-inflammatories for the knee, or they take the opiate medications, which can become habit-forming for the knee. We're looking at an option that is non-habit forming, non-addictive, a topical preparation, and
those are popular. A lot of doctors are choosing or opting to give patients medication that is like an ointment or like a topical cream, and it takes away all of the side effects of having to go on medication.
Absolutely. Yeah. And you know, and I know we're covering a lot of different things.
Keep covering, keep going.
But you know, for diabetes, especially type 2 diabetes, are the patients that we want to direct our attention to. And so, you know, it's very important to have your diabetes controlled, because if your diabetes isn't controlled, it puts you at a risk for a host of other medical problems.
Kidney problems, heart problems, everything.
Eyes, everything.
Eyes,
you know, it's just a real problematic disorder if it's not maintained. And so if you're taking a medication for diabetes, such as metformin, or if you're taking Lantus, and those medications aren't controlling your blood sugar like it should be, come on down.
Okay.
Come on down to the clinic. We have some medications that we're using in addition to those medications to help stabilize the blood sugar. And the other good thing, while you're in the clinical trial, those test strips, those blood sugar monitors, we're providing those to you.
They're very expensive.
And so you don't have that out-of-pocket expense too.
Okay, let's talk a little bit about asthma, because that's something that we hear about, and it seems like it's on the rise in children, and I don't know why, but what are you guys doing, bronchial dilators, or what are you doing with that? Is it a medication?
Well, we've got a couple of different asthma programs, and it's starting as early as 12 years old on through the lifespan. For some of our patients who are on medicine, but they're having exacerbations of their asthma during this time period, they're going to add in a medication to help with that. Same with the kids 12 and up. I mean, they could be on something like Singulair, but it's not your traditional, bronchodilator, type medications. These are medications that are really looking at the root of the asthma, whether it's allergic related or if it's inflammatory in nature, and it's kind of working to prevent the whole process from even happening. So it's not something that's available, at your local physician office. But, this time of year, you think about the flu, you think about asthma, all those symptoms, they're really at their peak around this time. And so there's an option to feel better.
To feel better. And what's your turnaround times in terms of getting in? If somebody wants to call and come down, is there a wait time, or how do we go about that?
Well, simply calling our office. The availability is up to you. If you want to be seen today, we'll see you today.
Wow,
if you need to be seen Monday of next week, we can see you then. We've got a host of clinicians, from nursing staff, nurse practitioners, physicians, a psychologist, whatever your need may be. We've got someone there that can help address it for you.
Do you guys ever write for the traditional medications, or is it going to be? It's going to be primarily what you guys are in the test trial phase for, correct?
Yeah, the medicines that we use in the clinical trial, a lot of them are they're new, they're not available, or if they are currently on the market, we're looking at them for different indications than what they're currently prescribed for. Sometimes people will come into a study where they're currently taking a medicine, like their asthma medicine or their an antidepressant or whatnot. And in some of our trials, we even have the option to help cover the cost of those medications while you're in the clinical trial.
That's wonderful.
So, there's lots of options available. The best way to figure out if you're eligible is to come down and meet with one of our clinical staff at the office.
And oftentimes, you guys do people compensation for taking part in the studies, so it's definitely worth coming in and figuring out.
Sure.
Thank you so much, Susan.
Thank you for having me.
Interesting to know about the flu, too. So,
Yeah.
again, if you have the flu or you know someone that does,
Come
free
on
medication,
down.
come on down. That sounds great.
Yeah.
All right, Susan Angel, CNS Healthcare, thank you
you.
so much.